All right, I think we're ready to go. Thanks everybody for joining us. We have Taylor Johnson here doing our presentation this evening. So we welcome you and welcome Taylor to tonight's training. I'll let Taylor take it from here.
All right, I am going to share my screen. Let me know when you can see it.
Yeah.
Okay. Everybody can see it?
Yes.
Yep.
Okay, perfect. Well, I appreciate everybody coming together today to learn a little bit more about CLTS at Eau Claire County. I am Taylor Johnson. I'm the CLTS manager here at Eau Claire. The purpose of today's training is really just to educate each of you a little bit more about what CLTS is. I have an agenda on the screen right now. So we'll do a general overview of CLTS, what the role of the support and service coordinator is, what to expect during intakes and recertifications, some clarifications on respite, and then I will leave time at the end for questions and answers. I do want to say at any point, if I say anything that is confusing, or if you do have a question that pops up, you can ask it before the end. But that is pretty much the gist of what we are going to go over today. I created this agenda in collaboration with our alternate care team just to get some hot topics of things that people would like for us to go over. So what I'm hoping to accomplish out of this presentation today is just to gain a basic understanding of CLTS and to help others learn a little bit more about the services and supports that the CLTS program can offer. You'll see the term participant used throughout the presentation, and that is referencing the child or youth that would be enrolled in our program. All right, so what is CLTS? CLTS stands for Children's Long-Term Support Waiver Program, and it helps children with disabilities and their families through supports and services that help their child grow and learn their best lives. A waiver program allows states to fund services and supports for kids with disabilities that are not funded through a traditional Medicaid. CLTS is a payer of last resort, so we do have to explore all resources before we can consider funding anything through CLTS. So a lot of times that is exploring if something can be covered through someone's IEP services, looking at community options, looking at grant-funded programs to see if we can get the service covered, and we cannot fund anything that is typically covered through Medicaid. So the goal of CLTS in general is to keep participants at home and in the community instead of an institutional setting. So a general overview of eligibility requirements. Individuals must be under the age of 22, eligible for Wisconsin Medicaid, living in an eligible setting, so either at home with their families, in a foster care setting, or other approved setting. So for instance, if a non-approved setting would be if someone is currently in a residential facility or a group home, or a hospital setting. Those are settings that we cannot serve that child while they're staying in that setting. Once they move back to the community, we could potentially serve them if they are eligible. So the purpose of CLTS is to provide supports to individuals that need the level of care of a hospital or a nursing home or an institution. The purpose of our services is to keep individuals out of these institutions when possible. So the last qualification is for people to be able to obtain safe, required care at home or in the community. I do want to take some time to talk about the top two bullet points of the younger than age 22. So we do have a requirement when kids or young adults are turning 17 and a half to refer to adult long-term care. That has its own screen, and essentially if a child or youth is eligible for adult services through that long-term care screen, they would have to transition services at the age of 18. They can't choose to stay in CLTS till they're 22 if they are eligible for adult programming. If someone is referred at 17 and a half for adult services and found ineligible for adult services, that's when we can continue to serve them up to their 22nd birthday. So to further elaborate on eligible for Wisconsin Medicaid, CLTS actually has its own form of Medicaid. So it is not income-based, and I'll talk about this a little bit more in the next slide as well. But CLTS is not income-based, and so the Medicaid source is also not income-based. Traditional Medicaid is often, Badger Care, SSI Medicaid, or there is Katie Beckett. I know I'm speaking to a group of foster families, so a lot of times the kids in your care are coming to you with foster care Medicaid. But if we do have a family that comes and is not eligible for any low-income benefits, we do have the ability to enroll them in waiver Medicaid to serve them in our program. So a lot of people ask if we have program cost with CLTS. And as I mentioned just a moment ago, CLTS does not have any income-based requirements to be enrolled in this program. However, there is a chance that a family could be responsible for a parental payment. How this parental payment is determined is based on the amount of services approved on the plan, your family size, and gross annual income. So you'll see on the slide that if anyone qualifies for those below benefits, they are automatically not going to qualify for a parental payment, no matter how many services are approved on the plans, because they are enrolled in one of those programs. And I do want to note, being a foster parent, you are not subject to a parental payment for the child that is placed in your care. However, if that placement moves towards adoption and the adoption is successful, at that point when guardianship would transition over to you as their parent, then you would be potentially eligible for a parental payment at that time. Right. So this slide is just going over what services CLTS can cover. I won't go into detail because, as you can see on this slide, there are a lot of different service descriptions or service codes that we can explore under CLTS. The goal for the services that we are implementing is to keep kids in their home and community, help them to be able to develop daily living skills, to learn new skills and develop new interests, and to live their best life. So a number of these services can be authorized at any point in time during a child's enrollment in the program. How these services are determined is using the Deciding Together guide. And that process is really to learn more about your family and how to best support you. And we really work collaboratively with families to identify what the need of your child is and the best way to serve your child as well. So we talk about goals and services, we weigh the pros and cons, we decide where to move forward, and then we authorize the service as appropriate. So what is the role of the support and service coordinator? Every child enrolled in CLTS will be assigned a support and service coordinator. Another term frequently used is case manager, essentially, is what the support and service coordinator is. So really their role is to coordinate and facilitate access to all services and support. That's informal and formal. So we are constantly looking at what can CLTS funded services support your family in doing, and then also looking at community resources, trying to coordinate Medicaid benefits and getting that child's needs met wherever the funding source may be. So it's really across systems, not necessarily just coordinating CLTS services. There are a number of things that CLTS SSCs for short will have to do. They have to maintain required documentation. We have to do our case notes, our service plans, assessments, things like that. And we also support, as I already mentioned previously, support youth moving into that 18 years and above, helping them transition their services to potentially adult services, or if they are staying in CLTS, helping them to coordinate to live their most independent life. And then, as always, we advocate for our participant needs. This is not an exhaustive list. It is just a example of some of the things that service coordinators might be doing. They do a lot, so this is definitely not the only things that they are responsible for, but should give you a little idea of what they are working on. CLTS does have required contacts to be enrolled in the program. So our SSCs have to complete monthly collateral contacts. So collateral means not necessarily directly with you and the participant. It can be with a teacher or another social worker in the department, really just getting updates about what's going on with the child and if there are any unmet needs currently. I will say more often than not, we are having contact with our families at least monthly, but the actual requirement is that it's monthly collateral, not necessarily monthly direct. So the requirement for direct contact, which means directly with the caregiver or the participant themselves, is quarterly. So sometimes that can be calling, texting, email, whatever it may be, going to see you at your house. It is not required to be in person or face-to-face, but sometimes that might happen, but really just checking in to see how things are going and making sure there are no unmet needs. CLTS does require plan reviews or service plans in general. That's how we really guide services. We're creating outcomes or goals for our participants and then authorizing services to help meet those outcomes. And in order to do so, we do have to have what's called our individualized service plan. So we do that at intake, and then we do it again at 6 months and then annual recertification. At least one of the plan reviews has to be in the home, which is typically the annual recertification meeting, because usually our intake meeting is also done in the home. So it just kind of lines up where you're doing the in-home at your annual. And then the other plan review is required to be in person, but not necessarily at home. So to go a little more in depth about what intakes and recertifications look like, they're essentially the same process, but an intake looks a little bit different because it's just starting out. So some of you, I don't know if all of you have children in your home that are enrolled in CLTS currently, but the process for getting CLTS rolling is essentially to refer to DHS, and you can connect with your social worker. They are very familiar with that, or calling our access line to request a referral. So what happens upon receiving a referral is it gets sent to our functional screener, who then reaches out to schedule that screen. What the functional screen looks like is it's a series of questions, essentially, where they are going over activities of daily living, communication, learning, social skills, mental health, any concerning behaviors that are going on with that child, and just gathering a lot of information about what is happening that led to that referral. The child does have to be present during a functional screen interview. And then we're also looking at collateral sources for information as well. So we're requesting medical records, potentially connecting with therapists or doctors or whoever else might be connected with that child. Functional screens also have to be done annually. That's how we determine eligibility for our program. So you're doing it at intake, and then you will be doing it again at recertification every year. So at intake, if you are found eligible, that's when you start. You would get assigned a support and service coordinator, and then you would start the rest of the enrollment phase. There's a lot of paperwork initially. I think we've condensed it a little bit. We made essentially a checklist style form where you can sign the bottom saying you received a bunch of our paperwork that we used to require signatures on. But there still is, I believe, 5 or 6 forms that we have to have signed to begin enrollment. So there's a lot of paperwork, and that all has to be renewed at recertification as well. Once you have that initial intake paperwork meeting, you then move into the assessment phase, and sometimes that will start at that initial intake meeting too, just depending on time. And that's really just going over, you know, all the information about the child. Some of the stuff is already gathered in from the functional screen, but oftentimes we don't have the same person doing the functional screen and the assessment. So you might have to repeat yourself a little bit, but it's just going over social backgrounds, behaviors, mental health concerns, any cognitive delays and how that impacts the child, your family dynamics, things like that. Once you have the assessment developed, then you move into the service planning phase. And that's where you're sitting down with your service coordinator and developing those goals for the child in your home and discussing what services would be appropriate. So again, all of these things are done at intake and then again at recertification. And then the individual service plan is what is updated at 6 months as well. The assessment and the paperwork and the functional screen is only annual. So the 6 months are pretty simple compared to the other reviews that have to take place. One thing I did want to note is we are always assessing progress on outcomes, and there is potential at service plan reviews that, you know, there's always potential for services to be added, but there is also potential for services to be reduced or ended based on improvements made over the last 6 months. I did also want to make a special note for children in foster care. If the bio family still has rights or DHS does not have custody, we still have to essentially run any service plan changes by them and make sure that they are comfortable with the services that are being proposed for their child. All right, wanted to move into respite care. That is one of probably the biggest services we authorize as like a one-to-one type service. We authorize a lot of different things, but this is one of the most commonly authorized services, I would say. So I started this slide with the definition of CLTS respite, and it states respite care services maintain and strengthen the participants' natural supports by easing the daily stress and care demands for their family or other caregivers on a short-term basis. So one of the important things about CLTS respite is it's really driven by the caregiver's need for a break, and the amount approved is established by the support and service coordinator. The amount can sometimes fluctuate depending on the needs at that current time. So there are times where there may be a temporary increase in services and then we go back down, you know, it could decrease in amount depending on what that caregiver is saying that they need for respite. One of the biggest challenges with respite, especially with our non-foster families that are coming into CLTS, is CLTS doesn't necessarily have a pool of providers to select from respite. So when families come to us saying, we need respite care, we don't necessarily have a directory of people we can call up to say, hey, would you want to take this kid for respite? A lot of times it's on the family to recruit for their own respite provider or use their natural supports. We have a lot of grandparents that are respite providers, a lot of family friends, things like that can be set up as respite providers. We do have another service that can support families with identifying respite providers if they don't have those natural supports and don't have the ability to identify a provider themselves. That's called support broker services, and that can be authorized to support a family in identifying and recruiting for a provider. FMS agencies and timelines for services. FMS stands for Financial Management Services. So in CLTS, we essentially use a third party to manage timesheets, payments, kind of the accounting stuff related to paying respite. And they're essentially the employment agency for the respite providers. We authorize the service, but they handle all of the employment related tasks. So one of the biggest questions we get, or a barrier we sometimes run into, is a family calls us, they say respite, it's not, or they need respite. It's not something we can immediately start if they don't have somebody already established as a provider through a financial management agency. It does take time. So typically if someone is saying, hey, we need respite and we're looking for a provider, once we identify a provider, we send them over to the fiscal management agency, and then they still have to go through their process of setting them up as an employee. So it's some tax forms, they have to pass a caregiver background check, they have to sign some paperwork saying that they have been trained on that child's needs and things like that before we can start funding it, because we need that documentation and background check to be able to confirm that they are, or to qualify them as a provider, essentially. One of the important things with CLTS is our rates are set by the state. We have no ability to set our own rates with respite. They probably back in 2022 came out with a uniform rate setting initiative. And so through that rate setting initiative, any one-to-one services that can be provided through CLTS, the state set those rates for us. So with respite, there are 3 different care levels, and that is dependent on the child's need and the assessment completed by the assigned SSC. So there is potential that, depending on the children in your home, there could be 3 different rates assigned to each child. So it's low, medium, or high needs typically. I will say more times than not, our kids are fitting in that medium category, but it just depends on that child's needs. There is also individual versus group rates. The state has essentially identified that CLTS kids going to respite should be in a situation where there is no more than 3 kids being served in that household for respite at a time. So with that 3-kid max, there are group rates for groups of 2 that are going to respite, and then groups of 3 as well. It's not necessarily you get the individual for each child that you are receiving respite. It's I would have to pull up the rates to name them specifically, but what I wanted to just identify is that there are group rates. So if you are at any point having multiple children in your home for respite or sending multiple children at the same time to respite, you just want to make sure that you are notifying that support and service coordinator that it is going to be group respite so they can put the appropriate authorizations in. There is also a different code for hourly respite versus day respite. So day respite is anything 8 to 24 consecutive hours. So that's more so our overnights, although it doesn't necessarily have to be overnight. It just has to be over that 8-hour time mark. And then there is hourly for those shorter durations that are less than 8. What I would say is, that is determined as well by the support and service coordinator. I would say typically if you have a provider that is providing services for 8 hours and 15 minutes, they're probably still doing the hourly rate because they are barely over into that day rate range. So just wanted to make note of that. Going into some of the exclusions with CLTS funded respite. I wanted to talk about this in this platform because there is a good bit of differences between family services funded respite and CLTS funded CLTS funded respite. CLTS has a lot more like rules and regulations as to when it is appropriate to use CLTS and not. So CLTS respite cannot be used for crisis respite. If at any point that occurs, that would have to be approved through the family services worker. Respite through CLTS cannot be used while the caregiver is working or at school. Hours and days exceeding the amount approved on the ISP cannot be used for CLTS funding. Again, I do want to circle back to the hours and days can fluctuate on the service plan. So the main thing is to make sure that you are following what's on the service plan and communicating appropriately with the support and service coordinator if there is a need for more respite. What we don't want to see is we have 4 hours of respite on the plan approved, say weekly, and then families are using 8 hours a week weekly, and they're running out way faster than we knew. We would really like to have that conversation to discuss the needs so that our authorizations are accurate, and then also our plans are reflective of what the actual need is and what's approved. I put on here if the reason for respite does not fit within the CLTS service description. So going back to CLTS funded respite is really driven by that caregiver's need for a break. I know there are a lot of reasons that respite is funded on the family services side that are a little bit different, you know, sibling connections. I've seen situations where there was going to be a move-in placement and to promote bonding with the new foster family. While I completely understand how important those things are, it just doesn't fall within our ability to fund it on the CLTS side of things due to the service description and limitations that we're having to follow. We can't fund respite for the child to be out of the home more than 50% of the time. So we can't approve 20 days a month of respite when there's, you know, only 30-day months. We would have to be considerate of that. That is also important to keep school in consideration as well. If we do have a child in school all day, we take that into consideration with how much respite is going to be approved on the plan. CLTS respite cannot be used for over 72 hours without support and service coordinator approval. So that is a little bit different for this group because I know a lot of times y'all are using foster homes for your respite providers as well. This is more accurate for families who identify their own provider. So, you know, a friend or whoever who doesn't have that foster care licensure. The reason this is a requirement is because if we have a stay over 72 hours, we don't have to get them licensed as a foster home, but we do have to follow a good portion of the licensing code to make sure that that home is a safe environment for that child to go to because they are going to be there for an extended period of time. And then CLTS respite cannot be used for temporary placements either. There have been times where someone might be placed in a home for a short period of time before they go somewhere else. That's not really a way we can use our funds to support. All right. Oh, I think there's one more slide. Here we go. So I just wanted to thank everybody for joining us for our presentation. I got through that pretty quickly, but I wanted to make sure that I left plenty of time for any questions that people might have. So I hope that gave you a little bit more insight into what CLTS is. And I will open up the floor for any questions. Stop sharing my screen too. Get out of this PowerPoint. Great. Does anybody have anything that they want to ask? quiet group. All right. Krista, Cheryl, Shannon, I don't know if y'all have anything that y'all wanted me to clarify, but I'm not seeing any questions in the chat. No.
Thank you, Taylor. I think that if anyone does have questions, we certainly can send them your way.
Mhm.
I think that might be a, let's certainly create that opportunity if we could.
Yeah, absolutely. And definitely if anybody ever has any questions about CLTS, or if you ever, even a family member, friend, or kids you hear about, if you're considering CLTS or have questions if they would be appropriate for a referral, you can always reach out to me as well. We don't have a wait list for the first time in a very, very long time. So we are able to get people screened and enrolled pretty quickly, which is really exciting. So
That's great that you guys got your wait list gone.
yes,
Perfect.
it's been a long time coming. For those of you who might not know, we had a wait list that was 3 years long for a very long time, up until the last 6 months to a year. We finally were able to get staff support and onboarded a bunch of people last year, which is really nice. So we're able to serve all our kids very quickly now.
Wonderful.
Okay.
All right.
Well, I appreciate, like I said, everybody coming together today. I hope this was an informative presentation, but definitely let me know if you have any questions, and I hope everyone has a wonderful afternoon.
Okay, thank you.
Thank you again, Taylor, for taking the time to spend with us.
Thank you.
Absolutely. Bye, everyone. Have a good
Bye-bye.
one.
Thanks, Taylor. Good night.
Bye. Thanks, Taylor.